There are various reasons a pregnant woman will be advised by her doctor that the vaginal route of delivery is not going to be the best for an index pregnancy, in which case a cesarean section is usually advised. A cesarean section will be planned, scheduled ahead of time, or what we call an elective cesarean section. At other times, when speed of delivery is needed, then an emergency unplanned cesarean section becomes indicated. In most cases, an emergency cesarean section becomes indicated or becomes a necessity when labor is in progress, but labor becomes complicated such that the life of the baby and or the life of the mother is at risk. There are a number of times that complications in labor can be successfully managed such that labor eventually ends in vaginal delivery. But at other times, the life of the mother and the baby, or either of them, becomes so precious that an emergency cesarean section has to be carried out. Or probably, in other cases, there was an intervention to take care of the complication in labor, but this intervention failed at the end of the day. In the description to this video, or somewhere in this video, I'm going to be dropping a link on common indications for an elective cesarean section, that is for a planned cesarean section. And again, I'm going to be also dropping a link about the common complications of labor that, if not successfully managed, can lead to an emergency cesarean section being carried out on a pregnant woman who, more often than not, is already usually in labor. If you are new to my channel, I enjoin you to please subscribe and turn on your notification bell so that you don't miss out on my subsequent videos, and so that you can always come back to watch the videos that are already uploaded. In this video, I'm going to be sharing with us common reasons or 12 common indications why an emergency cesarean section is usually carried out on a pregnant woman, especially who is already in labor. Number one is failed induction of labor. Failed induction of labor. In most cases, a woman will go into labor naturally when a pregnancy is term, and this would usually end up in vaginal delivery. At some other times, when pregnancy is term and has become well advanced above what it should be, that is about 40 weeks gestational age, when pregnancy has become well advanced above 40 weeks, we have centers that their benchmark is 41 weeks. There are those that their benchmark for an induction of labor is 40 weeks plus 10 days. It depends on the country, it depends on the center. At that point in time, an induction of labor by medical methods is usually instituted. But depending on their protocol, once there is a failure of induction of labor, then an emergency cesarean section would have to be carried out to deliver the baby, so that at the end of the day, the mother is alive and well, and the baby also is alive and well. The second reason is what we call failed instrumental delivery. There are cases that this woman is already in labor, and there may be one or two complications that would necessitate to hasten up delivery, at which point the obstetrician will want to use some specific instruments, for example, what we call vacuum delivery or forceps delivery, to deliver the baby. There are a number of times that there will be failed delivery by the use of these instruments. At that point in time, again, an emergency cesarean section would have to be carried out. Number three, the baby to be born may become tired, what we call fetal distress. Once there is fetal distress, then would have to be delivered at the speed of that decision or at the speed of light. So once there is fetal distress, then an emergency cesarean section is usually indicated. During the process of labor, the vital signs of the mother is monitored. The cervix is also monitored for dilatation and other parameters that should indicate that there is progress of labor. Beyond the monitoring of the cervix and the monitoring of the vital signs of the mother, the fetus is also monitored So we say this baby is stable if the heart rate of the baby during the process of labor is between 120 and 160 beats per minute. Anything outside this range, either above the upper border of normal or the lower border of normal, we say that the baby is in fetal distress. At that point, an emergency cesarean section would have to be carried out. We could have hypertensive emergencies in labor, the number 4 points. Hypertensive emergencies in labor. The woman may be hypertensive before pregnancy. There may be a case of pregnancy. Hypertension may even come during labor. So when we have highly elevated, poorly controlled or uncontrolled hypertension or blood pressure, then an emergency cesarean section would have to be carried out. Complications of hypertension in pregnancy or even during labor could be such that we have terms like severe preeclampsia or eclampsia. In severe preeclampsia, there is elevated uncontrolled blood pressure in the presence also of high amounts of protein in the urine. Because one of the things that the woman would enjoy is that there will be urinalysis. That's a test of a few parameters in her urine. Protein essentially is not supposed to be found in urine. But when we have excessive amounts of protein in the urine of a woman in labor or in pregnancy, then that's in the presence of elevated blood pressure that is uncontrolled or poorly controlled, then we say she has severe preeclampsia. When the woman starts to convulse in labor or very late in pregnancy in the presence of severe preeclampsia, we say she has eclampsia. This revolves around poorly controlled or uncontrolled hypertension. It is an indication for an emergency cesarean section. Again, we could have what we call ABRUPTIO, that is a premature separation of the placenta while the baby is still in the womb, especially during labor. The baby normally should be delivered at birth before the delivery, the separation and delivery of the placenta. In ABRUPTIO, there is a separation of the placenta during labor while the baby is still in the womb. If there's a complete separation, it means that there's a complete separation of what gives life and nutrients to the baby, which is the placenta. There is a separation of it from the uterus. Now, at that point in time, an emergency cesarean section would have to be performed again at the speed of decision, at the speed of life, so that the life of the baby essentially can be saved. Number 6 very common reason why an emergency cesarean section is carried out is the failure of the cervix to dilate. In vaginal examination during labor, the cervix is expected to dilate from 0 centimeters to 10 centimeters. At specific regular intervals, the midwife or the obstetrician will come and do a vaginal examination to check the dilatation of the cervix. If the cervix is not dilating well, it is usually a common complication of labor. There are a few things that can be done medically to help the dilatation of the cervix. If this fails, then an emergency cesarean section would have to be carried out. Number 7 is when we have cord prolapse or cord presentation. In cord presentation, instead of the head of the baby to be felt at vaginal examination, it is the umbilical cord that is felt. This is a bad sign for the baby. In cord prolapse, the umbilical cord is not just felt, it is already out of the birth canal. When a doctor sees this or when a midwife sees this, then it is an indication that an emergency cesarean section would have to be carried out to save essentially the life of the baby and then to reduce the risk for the mother. Number 8, we could have what we call obstructed labor. It means essentially that labor was in progress, but for one reason or the other, maybe the passage was too narrow for the baby, maybe the baby was too big for the passage. what we call cephalopelvic disproportion, or there was an arrest of labor, something went wrong, and labor is no longer progressing. The labor that has started is no longer progressing. Then it becomes an indication for an emergency cesarean section to be carried out to deliver the baby. Number 9, the mother may become excessively tired following hours of labor, what we call maternal exhaustion. By the time the mother has lost so much energy, she's becoming weak, she's becoming very weak, and the willpower is no longer there, the energy is no longer there for her to continue the process of labor. Then the medical intervention is an emergency cesarean section so that she can be delivered of her baby safely, so that at the end of the day, we have mother and child alive and well. Number 10, very common reason or common indication for an emergency cesarean section is a renting of the womb, what we call uterine rupture. There are cases during labor when the uterus ruptures. At that point, beyond attempting to save the life of the baby, because of the degree of bleeding that starts to follow, the life of the mother becomes a priority to be saved. Quick thing to do, the best thing to do medically, is to take this woman to the operating room of an emergency cesarean section carried out on her, so that primarily her life can be saved, and again, if possible, especially if there is an early diagnosis of an uterine rupture, the life of the baby can also be saved. Number 11, another common reason why there will be speed, where there will be necessity for an emergency cesarean section, is difficulty or inability to deliver the anterior shoulder. That's the first shoulder of the baby. In this case, the baby's head during labor has already been delivered, but there is an arrest of this around the neck, or to what we call the anterior shoulder. That is the first shoulder to be delivered before the second shoulder. Once this happens, so that we can save the life of the baby and reduce the risk on the side of the mother, an emergency cesarean section would have to be carried out. The 12th reason I'll be sharing with us is when we have a previous cesarean section, and because there are no indications for this woman to go through a straightforward cesarean section again, she's allowed to try labor. She's allowed to have what we call a VBAC, vaginal birth after cesarean section. So if there is a trial of labor, if there's a vaginal birth after cesarean section, that is trying for this woman to deliver vaginally after a previous CS, and there is the presence of any of the other factors or reasons or indications that are already listed above, it calls for an emergency cesarean section. We should understand that what we want at the end of pregnancy, irrespective of the route of delivery, is that the mother and her baby, or babies if it's a multiple pregnancy, are alive and well. It is not compulsory that every woman that is pregnant must deliver vaginally. There are cases, just like I said, there is a planned cesarean section ahead of a scheduled date. But when things go wrong during labor and complications cannot be successfully managed, such that the life of the mother and the baby or either of them is at risk, an emergency cesarean section is usually advised at the speed of light, at the speed of that decision, at the speed of thought, so that mother and child can be alive and well, especially in sub-Saharan Africa, in our very rural communities, amongst the very poor people, so that we can start and continue to improve our maternal health outcomes. Again, I would encourage you, drop your comments, ask your questions in the comment section. If you've not subscribed, please, you will do well to subscribe and turn on your notification bell, so that as my subsequent videos are uploaded, you don't miss out on any. Until my next video, cheers.